Hi everyone, my name's Jennifer Seaver. I'm a clinical nurse educator and I'm here today to talk about something very familiar to us all. It's a routine that can potentially save numerous lives and one that we've all been taught since we were toddlers. Hand hygiene. This is described by many healthcare workers as possibly the single most important tool in preventing the development of healthcare-associated infections between patients. Infections such as Staphylococcus aureus, Clostridium difficile, MRSA, and gram-negative bacteria. Most hospitals have strict policies and guidelines that we must all abide by. So if it's so important, why do we continue to see such an underutilisation of such a basic practice? Why don't we follow the procedures that should already be ingrained? This, unfortunately, has proven difficult to determine. Let's first put things into perspective with new data from the Centers for Disease Control and Prevention in the USA, which found that 1 in 25 patients acquires a healthcare-associated infection during their hospital care. Now, for whatever reason, this figure doesn't tend to set off any real alarm bells in people, but that adds up to about 700,000 infections a year, a little more alarming. The clincher, however, is of those, 75,000 patients die from their infections. That's an incredible number, and one that should shock anyone hearing it, because it's a number that quite often reflects human neglect and forgetfulness. One may even suggest at times laziness. Stopping the spread of infection by way of hand hygiene is hardly a new concept. Its importance was first brought to life in the mid-19th century when it was found that physicians who washed their hands before delivering babies prevented deaths in postpartum women. Such an idea was initially ridiculed, as most new theories are. But even now, after centuries of knowledge, it seems to me we're still, in many ways, ridiculing it by simply overlooking this basic practice. In stopping the spread of infection, even the most advanced healthcare is of little use if the basic principles of hand hygiene are neglected. We have valuable technologies and intricate tools at our disposal to prevent hospital-acquired infections, and yet such advancements can so easily be made redundant if healthcare workers don't toe the line and simply neglect to wash their hands. That doesn't sound like genuine advancement to me. One of the most valuable things about hand hygiene is that it works for so many different types of organisms, and you get a lot of bang for the buck, so to speak. Such great protection from so many nasty things by such a simple and inexpensive action that any person can do with ease. The issue is that you have to practice it at a high level of compliance for it to work. Within a hospital setting, there are so many opportunities for hand hygiene, and it's difficult to get a level of compliance where we're able to make changes to infection rates. What we need to do to combat this is to turn hand washing into what many people already suppose it is, an instinctive ritual. So how do we monitor people in a healthcare setting without hovering and interfering? The gold standard in monitoring hand hygiene compliance is direct observation. But the reliability of this method to measure true, actual compliance is questionable. This is because it increases dramatically when observers, who are usually well known to the staff, are circulating in the unit. The rates then decline almost immediately once they've gone. Furthermore, being a known staff member also influences this. I'll give you an example. In one study, we hired a student for hand hygiene observation in the same unit as a well-known staff member. We found that the staff member observed close to 70% compliance and the student observed close to 30%. The bottom line is that there's a big discrepancy there. The main problem associated with a lack of hand hygiene compliance, I believe, is that humans are not, in fact, naturally hardwired to perform hand hygiene in the absence of sensing a substance on their hands. If compared with the use of seatbelts, for example, most people don't even think about putting the seatbelt on when they get into a car. They do it on a subconscious level, and they're usually not even aware they put it on. That's where we need to be with hand hygiene, hardwired so that we do it without even thinking about it. When a behaviour is hardwired like that, you can always sense when you didn't do it because you start to feel uncomfortable. It's a long process, however, to get to that end point.